Hi, my name is Perry Malzahn and I am a counselor with HopeNet. September is Suicide Prevention Awareness Month. So today I'm going to talk about some risk factors for individuals, also warning signs to look for, also ways to have that conversation with that individual, and then lastly, helpful things to say and unhelpful things to say. So when we look at suicide as a whole, we know that it can affect everyone either directly or indirectly. So we know that health plays a large role in it, particularly anything that's within the pain family. That can be a daunting diagnosis of, I'm going to have to live with chronic pain for the rest of my life. We also know that certain environmental factors, such as someone going through a divorce, or perhaps the loss of a loved one recently, or custody battles. For some specific warning signs to look for, you really want to look at someone's verbal and nonverbal cues. So what they're talking about, what their behavior looks like. So someone might be direct and say, I'm having thoughts of harming myself, or I'm feeling hopeless. If someone is talking about that, you can have that moment where it feels like, I need to freak out, I don't know what to do with this. But the best thing that you can do in that situation is remain calm and realize that they've given you a gift. They're inviting you into their life because they trust you enough to disclose some of the hardest places to be in. So framing it from the perspective of, okay, they've given me a gift, even thanking them for disclosing that can automatically build rapport with that individual. A very important question to ask that can be difficult and can feel uncomfortable is to directly ask them, are you thinking of killing yourself, and do you have access to a firearm? Directly asking that question is in no way going to increase their likelihood of either attempting or completing. All it does is open those channels of communication. One of the top things that seems to go when someone is suicidal is their physical appearance. They get to a point where they stop caring about showering, brushing their teeth, or what they look like. So really paying attention to their self-care can be an indicator of how they're doing in terms of their mental health. Has there been an extreme shift in their behavior? Are they now giving away prized possessions? That can be one of the largest red flags of this person is not doing okay. Some helpful things to say, most importantly, is to be that supportive listener. A lot of times we jump right into strategic mode of, I'm going to fix this for them. Sometimes it's just listening that's the more important piece than what do I do or don't say, but there are some things that we know just haven't been helpful for those individuals. And one that's extremely common is when someone might say, well, suicide is a permanent solution to a temporary problem. It's a very cliche statement, but there are a couple problems with it. One, we don't know that what that individual is going through is temporary. And also we want to be careful to never utilize the term solution with suicide. We don't want them to ever think that suicide really is a solution. It's an option, but not a solution. Sometimes we can also be tempted to say, oh, your life is not that bad, or it could be worse. Saying that it's not that bad is only going to alienate them more and make them feel like you're dismissing their concerns. And saying, oh, it could be worse, all that does is make them think, oh, well, if it could be worse and I'm already in this place, then there's absolutely no hope. Sometimes I've heard individuals say, oh, well, suicide is cowardly. And again, all that does for the individual is elicit shame. And one of the most common ones that is very well intentioned is, I would be devastated if something happened to you. That feels like, oh, this is a bid for connection so that they know that they're loved, so that they know that they're supported. But what can end up happening is the suicidal person, in their perspective, already feels like a burden. And in their mind, they can get to the place of, well, if I choose to exit, I'm no longer a burden to my family. I'm no longer a burden to my friends. Someone to talk with that they feel like gets it, that they feel like can understand what they're going through, because oftentimes suicide is not about death. It's really about not suffering anymore.